Hey Lisa, can you hear me?
Hello?
There you go. Hey.
There you are.
How are you doing?
I'm doing great. How are you?
Good. We finally connect.
I'm sorry about that. I've had some, life
It's all right. So how have you
been
been
happening.
how have you been feeling?
I am feeling much more energized.
Nice.
It helps at work. I'm doing a lot more catering. So I'm like I have low tables and I'm like this all the time. So that really is helpful with all the pain and agony and stress I go through. So I think it's really helping with that anyways.
Well, so I read through your initial kind of report the other day, and I wrote down some things. So your first visit was in kind of the mid to end of May, and the three symptoms that we were really working on were your Raynaud, so like the coldness in your hands, the acid reflux, and your energy level.
My name is Lisa Shireman, and I have a few issues. I have a lot of acid reflux, a lot of agita every time I eat or drink, and that wakes me up at night sometimes. And I have a couple different syndromes: Raynaud syndrome, Fuchs dystrophy, bone spurs. For the acid reflux, yes, I've gone to the doctor and I've taken different medications and things, and it just keeps recurring. So it's not really going away. I've gotten temporary relief, but I have not got real solutions to these problems. I'm due for surgery and different things, so I really want to try something different before they cut me or before it's, something serious really occurs.
So it's at the point right now where just based off of the patient's symptoms, I have a very good idea on where they're having the problem, where I'm going to need to assess and treat. I always give it the possibility of it being in other locations, but you can whittle it down to a certain area, and just based off of Lisa's symptoms for her Raynaud's, for her fatigue and energy levels, as well as for her acid reflux, I can basically guarantee you that her T4 area of her spine is going to be very tender, and then her T8 to T10 area of her spine is going to be very tender. And I'll kind of show that on the initial evaluation, and I won't show her where those areas are, but I'll be able to show the camera and the people at home where those areas are. Involved for your acid reflux, it's going to be this area, and your generalized fatigue is actually going to be more this area. So those are going to be the areas that are going to be most tender on you. And again, I said the T4 and to T10. T4 is going to be the main one for energy and Raynaud's and hands. The acid reflux is going to be more the T8 to T10. And Lisa, do you know what those levels mean at all?
Absolutely not.
Perfect, good. Because I don't want you to. I don't want to skew you, right? So I'm just going to put some pressure through your back.
6. Oh, 8.
8, and then how about here?
It's about 6. 9.
More than the other side?
Yeah, that hurts.
Is that the most?
Probably.
L4?
Yeah.
Can you throw a number on it?
8.
And that's L4.
Okay, that's 6.
So this was worse?
Yes. Sorry.
All right, so that correlates with your ankle, okay? And I don't know if you remember, but I said L4. So called my shot T4 to T10 and then L4. All the areas that would explain your symptoms that you're having are the areas that are involved in your back.
That's crazy.
Okay, come on up. I'm going to start with the one exercise to show you, and then I'll show you another, and then I'll give you a little bit more of what to look for and what to expect in the next few weeks, okay? My goal is to get the patients to where they don't need to do these anymore. Most of the time the patients choose to continue, and at the very least, if you stop and your symptoms start to come back in the future, you know what to do for yourself, okay? You're gonna put this right around armpit level. If your elbows can kind of just barely scrape over this, it's right, okay? There you go. Bring the foam roller a little closer to you.
Yep. Oh, before I do that.
You'll get better at it. Sag down here. And again, you won't have a lot of movement. That's why we're doing this, right?
Okay.
And you're just letting yourself drop down to the floor. Give yourself some time, breathe. Let yourself fall down to the floor, keeping that neck as tucked as possible. Give it one more good deep breath. Try to pull yourself down to the floor. Good, that's great. Now you can let your head go all the way back. As far as you can go. Good, now come back up. Nice and light, but you're trying to get your arms back more and more towards me. We're trying to feel this anywhere from this area out to about this area, okay? Both together as well as back and down, and that you'll feel it down here a little bit.
I can feel my arms are getting warm.
And let your arms drop down.
Oh, let my arms drop down.
Yeah, you should notice more blood flow to the area.
Right? Yeah.
And you know how earlier when I had you raise your arms up and you said you felt like you were losing circulation? Well, your arms have been up longer than before, right?
Yeah. And they're getting warm. That's crazy.
How do you feel after your first session?
Sore, but I do kind of feel better and hopeful and positive. This is positive. I noticed after my first session things happening in my body that I wasn't expecting that were positive.
So the bone spur diagnosis for her is very frustrating, and the fact that they are setting her up for surgery for something that, in my opinion, is not a bone spur at all. And it should be pretty easy to diagnose. So the area where she has her symptoms isn't the area where a bone spur in that area gives symptoms. So the doctors get bone spurs wrong all the time. Bone spurs are very common throughout your body, and most people don't realize this, and the doctors don't tell people this. Bone spurs are a naturally occurring presence in your body without pain. But when you have pain, you go to the doctor, they do imaging, whatever they find on the image, they're gonna correlate that to your symptoms, whether it's the cause or not. So all of these areas that you have commonly occurring bone spurs throughout the course of your life without any symptoms, they're gonna miscorrelate to your symptoms. And that's gonna cause you unnecessary pain, expense, and treatment that you don't need that has side effects.
Check.
Perfect. All right, I'm ready.
Yeah, you start.
Hi Lisa, how you doing?
Hi, I'm doing well. How are you?
I'm doing great. So this is your second visit to Dr. Slater. It's been not quite a week, but how are you feeling?
I'm feeling pretty good. I'm surprised I'm not as sore as I thought I would be. So that's a good thing.
You were expecting to be sore after what he did and worked on you?
Yes, because it was pretty sore while I was doing it. I do notice today that I'm feeling a little different in that I am already feeling a little more mobile and flexible. After I do my exercises in the morning, I do feel like the blood is flowing through me and it's energizing. Gets all the kinks out.
Looks good. Give yourself some time, take some nice deep breaths. Use your muscles to kind of pull you down to the floor a little bit. Almost always have to troubleshoot the exercise. You know, I only gave her 2 exercises on the first visit, but here on the second visit, there's some subtleties of the exercise that unfortunately they are important, and that really is the value of having these exercises done under guidance, either in person or over telehealth, because inevitably or invariably somebody is going to do the exercise just a little bit wrong. They'll put the foam roller a little bit too low or a little bit too high, or they'll try to arch from their low back, or they'll try to use their neck. They'll try to do something to compensate because it's just easier for them than moving the area of the body that's stiff, stuck, painful. And me being able to change that, me being able to assess that and show the patient and have them feel the difference, that's really important. And again, it's almost always that on the second visit and on each subsequent visit, I go over the previous visit's exercise or movements for that reason. And I almost always have to make a little bit of a tweak. And that tweak does make a big difference. Nice. These are strengthening exercises. These get blood flow going. These get your muscles contracting. That's how your body heals. These will make you ultimately not only feel better, but stay better. The other ones make you feel good right away. Like you feel looser right away. This one will keep you better.
I was pretty skeptical about the whole thing, quite frankly. But, you know, the more you spoke about it, the more it made sense.
At any time going to the doctor, did they ever mention that it could be your spine?
No.
You went to a doctor, they said you need surgery, and you were scheduled for surgery, right?
Yep.
Yeah. And it's kind of insane that so many people out there that were in the same boat as you. You just happen to know somebody that knows me, and you know, you gave this a try and you gave it, you know, your effort too. So good for you for putting in the effort and keep advocating for your better healthcare. But so many people out there either don't know that there's something else, they don't have the options, they're looking for the quick fix, and they end up getting the surgery, and the surgery wasn't needed, turns out to not be helpful, and now they're worse off financially, physically. I mean, it's just, and it's so common in our healthcare system.
People have to expand their worldview medically, in that the traditional way of just drugs and medicine and quick fixes is not necessarily the way to go. They need to look into other alternative. The spine, yes, of course, the spine is like your core. Your organs and your spine are so important to your health and your well-being, and it's like your whole. I'm thinking of an electrical line that powers everything.
I mean,
in your body.
it's your motherboard of your computer, right? I mean,
Yep, motherboard. There you go. That's a good word.
But it's cool. That's kind of the effect that I'm trying to have. I just want people to think that, hey, there's another solution out there. There's another possibility, and it's worth a shot.
Right. Absolutely. Like I say, you can try different drugs and you can have all sorts of issues with them, and you can. Oh my God, you listen to the television and you hear, well, this could happen, this, and it goes on for 10 minutes, all the side effects you can get from this drug. And it's like, is it worth it? So, my gosh, this is just, it's amazing. It occurs to me that I really don't have the acid reflux anymore. My energy levels have improved significantly. I have to make myself go to bed at night because I'm still awake and working on the Raynauds. So Dr. Slater has really, I'm so thankful that I found him and that he explained his methods. Okay, thank you so much. I appreciate you very much.
Oh,
Have
thank
a great
you.
weekend.
You too. All right.
Thank you.
Bye.
Bye.